laboratory workforce database. And today, this biosafety and biosecurity will be one of those. So I really appreciate, all your support, and also, for coming all the way today to attend this the launching ceremony. Thank you. So this program, when we started it in 2019, we hosted the Global Biosecurity Dialogue, actually in this room, where a very strong group from Global Affairs Canada, USCDC, DITRA, and others came in, and we started, the inception of this program. So from the very beginning, this program was strongly supported by Government of Canada, and we really appreciate your support, both financial and technical support. Trevor Smith has been there from the very beginning, from the inception of this program. And Your Excellency, Ambassador Stefan, your presence here today is another commitment and indication that you value this partnership and you are committed to the cause of this program. So we really thank you for coming here. So I would like to give the floor to Your Excellency, Ambassador, to address this audience and the larger audience that are attending virtually today's session. Over to you, Ambassador.
Thank you very much, Dr. Getachew, Dr. John, Dr. Tuckmore, Dr. Yeno, Dr. Nobile, distinguished participants here at AU HQ and on Zoom across Africa. I have to admit I'm intimidated by the presence of so many doctors. So please, I welcome your support. I'm grateful for your invitation. On behalf of the Government of Canada, it's my pleasure to join you today at this launch of the Regional Training and Certification Program for Biosafety and Biosecurity Professionals. Let me begin by expressing our sincere thanks to our partners at the Africa Centers for Disease Control and Prevention and the African Union for organizing this event. Canada is pleased to work in partnership with AfricaCDC, and we welcome the work that we are doing together to strengthen biosafety and biosecurity in Africa. The critical importance of our collaboration has been underscored by the ongoing COVID-19 pandemic. The world now recognizes what we and you have known all along, that an isolated biological threat can very quickly become a problem in every place. In this regard, when it comes to enhancing biosecurity capacity, we're all in this together. We must strengthen global capacity to prevent, detect, and respond to infectious diseases threats, whether they are natural, accidental, or deliberate in origin. To you, our African partners, this is not news. For far too long, infectious diseases have impacted the lives of many people on the continent. They arise and they recede, but they never disappear. Following the 2014 Ebola outbreak in West Africa, G7 foreign ministers committed to strengthen biosecurity in Africa through the global partnership against the spread of weapons and materials of mass destruction. The global partnership has a proven track record of accomplishing hard things. For nearly 2 decades, it has succeeded in reducing serious international security threats. It has also played a key role in building sustainable health security capacity in Africa and worldwide. I'm happy to say that Canada's Weapons Threat Reduction Program, which is our contribution to the global partnership, has been at the forefront of this effort in Africa for more than a decade. I myself have worked in the Global Partnership Program in Canada as director in 2009 to 12, working with Trevor Smith that you have mentioned. To date, this program has delivered more than $60 million in biothreat mitigation programming in Africa, much of which has supported COVID responses. We have delivered this work in close collaboration with the AfricaCDC, African nations, and international partners. We are pleased with the successes that have been achieved, but our work is not done. Biological threats are on the rise, and that includes the threat of disease being used as a weapon by states or terrorists. The ongoing invasion of Ukraine and threats made by Russia about the potential use of biological weapons and other weapons of mass destruction has brought the biothreat to the forefront. Canada's continued commitment to strengthening biosecurity and building health security capacities in Africa is reflected in ongoing leadership of the Signature Initiative to mitigate biological threats in Africa, which is being implemented by the Global Partnership. The aim of the Signature Initiative, which is being delivered in close collaboration with AfricaCDC and other African partners, is to reduce biothreats to the aligned activities of Global Partnership and African countries working towards the same goal. We are confident that policies and initiatives such as the development of this regional training and certification program will support the evolution and impact of the Signature Initiative and encourage African partners to play an active part in discussions on the 4 pillars of the initiative. First, biosafety and biosecurity. Second, national governance structures. 3, surveillance and epidemic intelligence. And 4, non-proliferation. Initiatives such as this will ensure that African countries have the capacity to prevent biological threats. In November last year, we announced a further commitment of $10 million from Canada's Weapon Threats Reduction Program in support of the Signature Initiative. I am pleased to say that as part of this announcement, Canada's Weapon Threats Reduction Program recently committed a further $5 million to support AfricaCDC biosafety and biosecurity efforts over the next 3 years. We are likewise supporting an important conference in the United Kingdom next week on turning Signature Initiative commitments into action. My colleagues from the Weapons Threat Reduction Program look forward to seeing some of you there. In closing, let me assure the practitioners gathered here that Canada highly values your work, your expertise, and your commitment. We commend you for all your leadership and your dedication. Thank you very much.
Thank you, Your Excellency, Ambassador Stephen, for your commitment again in supporting, the AfricaCDC Biosafety and Biosecurity Initiative, and also emphasizing, global coordination and commitment. And the Signature Initiative is trying to bring also, others on board to do the same. So Canada is setting an example by supporting such programs, such regional program. We really appreciate your commitment and thank you for coming here today to be part of this launching program. So, ladies and gentlemen, Your Excellencies, we are closing towards the end of this program. So next will be the official launching of the training program by Dr. Getachew Tolera, Deputy Director General of Ethiopian Public Health Institute, representing Ministry of Health of Federal Democratic Republic of Ethiopia. So Dr. Getachew, thank you for coming. So I would like to invite you to give us your opening remarks and officially launch this training program. Thank you. Over to you.
Yeah, thank you very much. Good afternoon, good morning. I want to recognize the presence of Dr. John Nakan Gasong, Director, African Center for Disease Control and Prevention. His Excellency Ambassador Stephen Joben, Ambassador of Canada to Ethiopia, Djibouti, and Permanent Representative to African Union. Mr. Nobile Luvo, CEO, Africa Society for Laboratory Medicine. Dr. Yeneno Kabede, Head of Division of Laboratory System at AfricaCDC and Director of Ceremony. Mr. Tokomor Maruta, Chair, Regional Biosafety and Biosecurity Technical Working Group Chair. And also I want to recognize the presence of Dr. Ahmed, Deputy Director of AfricaCDC, and all protocol are observed. Distinguished participants and invited guests of the official launch ceremony, ladies and gentlemen, First of all, I would like to thank the AfricaCDC for inviting me to make official launching remark on this official launch of the African Regional Training and Certification Program for Biosafety and Biosecurity. On behalf of the Ministry of Health of Federal Democratic Republic of Ethiopia, the Ethiopian Public Health Institute and myself, I would like to warmly welcome you all to this very important and special event. Proper implementation of biosafety, biosecurity program and activities is a fundamental and crucial for protecting the workforce, the environment, and the wider community from the unintentional exposure to pathogenic biological agents, hazardous toxins. However, many assessments and studies have revealed that several factors and challenges are impeding the proper implementation of biosafety and biosecurity programs in almost all countries of African continent. The World Health Organization Joint External Evaluation Technical Assessment conducted between 2016 and 2019 and the Global Health Security Index of 2021 have clearly indicated limited capacity of African countries for the implementation of biosafety, biosecurity programs, thus remaining dangerously unprepared for effective response to potential epidemic and pandemic threats. The finding of this assessment and evaluation have unequivocally confirmed that the countries were either completely lacking of only having inadequate level of the required infrastructure and sufficiently trained professional workforce for the leading and managing biosafety and biosecurity programs implementations. The COVID-19 pandemic has later objectively exposed this critical capacity limitation and gaps, serving as a wake-up call to all concerned entities to undertake appropriate practical action at national, regional, and continental level in order to ensure the continent's preparedness to reliably prevent, safely detect, and effectively respond and contain the next pandemic, which can be more cruel and devastating to the health of the public and its socio-economic fabric than the current one. Dear distinguished guests, Ethiopia was fortunate to be part of the World Health Organization Joint External Evaluation Technical Assessment that was conducted in 2016 and clearly revealed significant gaps in overall capacity and preparedness of the country to capably prevent, timely detect, and respond to events of public health concern, just like similar findings documented elsewhere in other African countries. Ethiopia's status as related to its capacity and preparedness in the biosafety and biosecurity arrangement was troubled, concerning with significant gaps that need utmost urgent attention and actions. Complete lack of national legislation pertinent to the implementation of biosafety and biosecurity program, no documented information on the type and extent of specific pathogen, biological agent, and hazardous toxin affecting human and environment. No legal framework to register and control laboratories both in the agricultural and public health sectors that handle dangerous pathogens and toxins. No national program whatsoever for advocating and promoting biosafety and biosecurity programs as a critical component of the national health security agenda, and immense unmet need in the training of laboratory professionals in the biosafety and biosecurity requirement and practice. Complete lack of trained biomedical engineers, personnel for the selection, installation, maintenance, and certification of biosafety cabinets, including the absence of adequate infrastructure at all levels of the national laboratory system for the proper implementation of biosafety, biosecurity programs. Seizing the opportunity of these findings, the Ministry of Health of Ethiopia and Ethiopian Public Health Institute were immediately prompt to develop a national strategy for the implementation of biosecurity and biosafety programs across the national laboratory system. The initiative was technically supported by CDC through the generous financial support of the Global Health Security Agenda and the PEPFAR country program. As part of this support, a functional national system could be established with mission to lead, manage, and promote the implementation of biosafety, biosecurity program at all levels of the national laboratory system. The National Biosafety and Biosecurity team of the Ethiopian Public Health Institute, which was established in 2016, has been energetically working to improve the capacity of country towards meeting biosafety and biosecurity requirements as amenable to the international standard and regulations, such as International Health Regulation of 2005. The national team has ever since been overseeing the drafting of national legislation governing the implementation of biosafety and biosecurity program in the country, identification and listing of hazardous pathogen, pathological agent, and toxin of public health concern, training of laboratory professionals and allied biomedical engineers, personnel in the biosafety and biosecurity program standardization, infrastructure required for the practical implementation of biosafety and biosecurity requirements, procurement of appropriate biocontaminants and facilitation of their installation, maintenance, and provision of certification service. As part of training program supported by CDC and Association of Public Health Laboratories, APHI currently has 3 certified biomedical engineers for the installation, maintenance, and certification of biosafety cabinet, a capacity that the Institute envisioned to strengthen considering the ever-expanding use of biocontaminants across the national laboratory system. Dear participants, ladies and gentlemen, the Ministry of Health of the Federal Democratic Republic of Ethiopia and Ethiopian Public Health Institute, in collaboration with their valued partners like AfricaCDC, USCDC, WHO, and others, are strongly committed than ever before to systematic implementation of biosafety and biosecurity programs in the country according with the strategies stipulated in the country's National Action Plan for Health Security, already developed in 2019 and ever since being implemented at all levels. As a member state of the African Union and ardent supporter of its specialized technical institution of public health affairs, the African Center for Disease Control and Prevention, Ethiopia is also committed to contribute whatever is in its capacity for the development of necessary capacity and system for the promotion of laboratories, biosafety, and biosecurity program in Africa. In this regard, Ethiopia highly appreciates and commend AfricaCDC Biosafety and Biosecurity Initiative to strengthen the biosafety and biosecurity program of African Union member states as per the documented capacity gap in the continent. Today's official event of the launching this training program for biosafety and biosecurity professionals is a part of the achievement of the initiative, and I'm happy to hear about the process and the consultation followed by AfricaCDC in identifying areas of specialty and the development of training program. I am confident that member states will be committed and greatly benefit from the implementation of the training program and elevate their biosafety and biosecurity status. Thus, I would like to use this opportunity to congratulate the AfricaCDC, all stakeholders, and partners who have contributed to the development of the special and highly needed program. Furthermore, I would like to assure the full support of Government of Ethiopia to the AfricaCDC and its partner in the proper implementation of the training program. Finally, on behalf of the Government of Ethiopia, allow me to extend my gratitude for the good collaboration from all parties involved in the implementation of this training across the continent. With this few key note address, I declare this special training program as officially launched. Thank you very much for your attention.
Thank you, Dr. Getachew, for showing us, the gaps in terms of IHR implementation. I think which is common to all other, African member states. And if you see, the JE scores, governments have not really, demonstrated all-rounded capabilities in a form of One Health concept to address biosafety and biosecurity. So that remains a glaring gap in the IHR implementation. And then thank you for demonstrating, your commitment to support us in this process, and also officially launching this training program today. Thank you. So finally, towards the closing, for all the remarkable progress that AfricaCDC did in the past couple of years, the vision and commitment by the leadership of AfricaCDC has been key. So we received all-rounded support in all of our program implementation from the senior leadership. We get, recommendations on daily basis. Their office open, to make any consultation. So I would like to really, thank the leadership of AfricaCDC, especially the director of AfricaCDC, Dr. John Kengason, in all of our programs. So I will finally like to invite Dr. Kengason to give us a closing remark and then set as a direction in terms of next steps about this certification program. Dr. John, the floor is yours.
Thank you, Yeno, for your leadership. Let me also thank everyone who has contributed in putting together this very nice program. The regional training and certification program for biosafety and security for professionals. For those who have followed my pronouncements over the course of this pandemic, the last 2 years, it's not a secret that I am really a strong proponent of regionalism, which means that we have to take global concepts, cascade them into the region and into the countries and implementation. So you would allow me to acknowledge the presence of His Excellency Jobin Stefan for your strong partnership in supporting these concepts. The leadership of the Public Health Ministry of Health of Ethiopia, represented here by Dr. Getachew, the Deputy Director of the Ethiopian Public Health Institute, my friend, colleague Ndovu, the CEO of ASLM. I know I've counted, there are about 250 participants on this very important meeting. It reflects the strong interest that member states and partners like to see this program move forward. And also allow me to recognize the presence of Tokbo, who I've known for many years, a very strong advocate, passionate lab person. We are very proud of what he's doing in the regional program in Lusaka, Zambia. And for the excellent presentation, the overview that he gave at the start of this presentation. And of course, the Deputy Director of AfricaCDC, Dr. Ahmed, who continue to be a pillar in everything that we do. So, Excellency, let me say this, that when I met with Trevor, your colleague in Australia, in 2018, we are discussing this collaboration. And it's one of those remarkable fast-forward collaborations that within 1 year, we were able to host the first meeting here, a consultation in this same compound, maybe in this room. And it's remarkable that it was perhaps the last consultation before we never met again, because it was in, I think, December or January 2019, because, or January 2020. It was very early on with coincided with the pandemic, the COVID-19. And it just demonstrated the importance of what we are here to discuss. But I guess my role was not to review the importance of biosafety and biosecurity, but rather to share my reflections on the way forward. I think there are only two things that we need to do to move forward. A is build more partnerships and hope that the endowing partnership exercise by the government of Canada in this specific area and the leadership that they have played will galvanize other G7 countries to rally around this very particular cause, because nothing of good in public health and global health security is achieved alone or is achieved by one partner. We believe strongly that our regional health security fits into the global health security. And without a very strong regional health security platform underpinned by biosafety and biosecurity, we will not achieve the overarching global health security, the collectivity of humanity that we have seen how much it can be undermined by a virus that emerges anywhere in the world. So a threat anywhere in the world continues to be a threat everywhere in the world. Excellency, we have endorsed as the African Union at the highest level the whole concept of a new public health order, which is very simple. It says that there are at least 4 things we must do to achieve Africa's health security sovereignty, and which is 1, support national public health institutions, including the ability for biosafety and biosecurity, and also other institutions like the African Medicine Agency, that it is only strong institutions that leads to regional health security and feeds into global health security. The new public health order talks or calls for manufacturing of diagnostics, vaccines, therapeutics, and there's no way you do those manufacturing without a strong biosafety and biosecurity component. The third thing is really about the workforce, and I'm very pleased that workforce takes a big chunk of this curriculum, and which point to the need to have a competency-based workforce. And lastly, partnerships with the private sector, what we are calling respectful, action-oriented partnerships. And this is also typified. So if you unpack our global health, public health order, the new order, this is one example of how that can triangulate very nicely into that. So it's not another slogan of the health for all by the year 2030 or whatever. It is practical, it is real, and we can do it. The second thing and the last thing I would like to leave you with is the implementation. Those who have worked with me, Lovo, talk more, understand that when issues are complex, you break down into smaller pieces, and you break down into smaller pieces that are recognizable and are also rewardable. If you reward them and you incentivize them, you move up the ladder. I think we've done this over and over in other very challenging, overarching laboratory strengthening there. So I'm hoping that you will, as part of this curriculum, tease out steps, smaller steps that countries can engage. My experience, 32 years in public health, is that if you dump it on countries, they run away from it. But if you break it into smaller pieces that are implementable, are recognized, are rewarded, countries will implement it. That's how we started the accreditation program. When we started that program, ASLM has been certifying this or can testify to this. There were only 20 laboratories on the continent of Africa that were accredited by any international standards. Today, because we break that down into smaller pieces, ASLM can testify to the fact that many more, hundreds of labs have now been accredited, which when we started that program in 2008, 2009 timeframe, everybody thought it was impossible. So I think I challenge you all to go home and think of incremental, stepwise processes of implementing the biosafety and biosecurity program. I look forward to staying engaged and continue to lend my support and voice to this very important program. So I thank you all, and Yenu, back to you.
Thank you, Director. With that high-level note and clear next steps in terms of what we need to do after this launching ceremony. So we come to the conclusion of this this session today. So I would like to thank Your Excellencies, all of you who came here and give us, your keynote address for taking your time. And then I would like to really thank, the participants, especially those who travel all the way to be here today with us, to attend this launching ceremony. And all of you participants who are attending virtually. So for all of us here in the room, so we'll go downstairs and then we'll have a group picture in front of Mandela Hall. Otherwise, this meeting has been concluded. Thank you very much.